Hi, my name's Jillian McCarthy. I'm one of the nurse practitioners here at the clinic.
Hi, Jillian.
Hi, nice to meet you. I'm just going to do some hand hygiene.
Okay.
Can you tell me your full name?
My name's Molly Swan.
Great. I'm just checking your wristband and your date of birth.
8/17/79.
Perfect. So I'm here today to do a couple of exams on you since you're a new patient here at the clinic. So I'm going to start with a cardiovascular exam to check out your heart. We're going to look at your belly and do an abdominal exam and then just kind of overall assess your peripheral vascular status.
Okay.
So if you have any questions or concerns along the way, you have any pain or anything comes up, please feel free to stop me and ask.
Okay.
Okay? So I'm going to go ahead and start with the cardiovascular exam.
All right.
Any issues recently? Have you had any chest pain, any palpitations, shortness of breath, dizziness?
No.
And no complaints, no concerns?
No, everything's
Great.
good.
Perfect. So I'm going to start by inspecting the patient, inspecting Molly. I'm going to just generally, well, before that I would actually start with her general appearance. She's awake and alert. She's, her speech is clear. She's following commands. She's making good eye contact with me. She's appropriately dressed for the situation. Her skin color looks within appropriate limits for her ethnicity, and she looks calm and she's cooperative. Her vital signs we've checked out and they're all rock solid, 100% stable, so that's great. And then I go ahead and start inspecting her from a cardiovascular standpoint. So I'm just gonna look at her chest. I don't see any obvious heaves. Her work of breathing is comfortable. I'm gonna go ahead and look at her jugular venous pressure. So I'm gonna assess for JVD, or jugular venous distension. I'm gonna look on both sides. I'll have you just kind of turn your head to the left. Great. And I'm gonna turn to the right. And I'm also at the same time looking for carotid pulsations, and I don't see anything obvious here. I would also go ahead and at this point, I'm just gonna expose you a little bit, inspect her chest here for PMI, point of maximal impulse, which I don't appreciate, which is a normal finding. So I'm going to, I'll cover you back up for a minute. I'm gonna go ahead and measure your JVP, and see what we got for that measurement. I'm actually gonna use this. So I'm going to start by just looking for the oscillation of the internal jugular vein, which I can actually see right here in the sternal notch. So I'm going to find Molly's sternal angle, which is pretty easy to palpate on her, and I'm going to go ahead and put my ruler right over that position, and then I'm going to look for the top or the meniscus of the oscillation, and I'm going to measure at a 90-degree angle across, and I'm measuring 2 centimeters, which is appropriate, so it should be less than 3, and that's reflective of your fluid status or your right atrial pressure, which fluid volume, so that's great. I'm also going to just go ahead and palpate your carotid pulses. So I'm going to just do each side. So they're strong. I say it's a 2+. I don't feel a thrill on the right. And I'm doing one at a time. And I also do not feel a thrill on the left, and that's also a 2+. And just to also make note, we already measured, but our bed is at 30 degrees ahead of the bed for the JVP measurement. So I'm gonna go ahead and move on from there. I'm gonna palpate across your chest wall. So I'm just gonna use my hand and kind of push along, and just so I can feel for any thrills or any kind of, if I can feel any kind of movements under there. So I'm gonna just start with the the aortic area. And it's a pretty necklace. Thank you. Pulmonic area. And then I'm going to assess down the left sternal border. So I'm gonna actually use the palm of my hand here. And then I'm gonna actually palpate over the PMI, or the mid-clavicular line at the 5th intercostal space, which I can actually feel palpating, and I could kind of narrow down the size here. Should be about 1 centimeter to 2 centimeters in width, which I appreciate that it is. And so that's great. So let's see. Moving on, I'm going to go ahead and listen with my stethoscope. So I'm just going to listen across all the areas. I'm going to have you turn onto your left side. I'll let you know when, and then turn back, okay?
Okay.
So I'm starting with the aortic. And then I'm going to move to the pulmonic. And then I'm going to move down to Erb's point. And then I'm going to move to the tricuspid. And lastly, the mitral. Great. So I'm going to have you actually turn to your left side while I have my stethoscope still here. Great. You can lay back. And I was just assessing for any obvious murmurs there. I'm going to use the bell of my stethoscope and come back up in the same spots there. So first over the mitral. Excuse me, over the tricuspid. Over Erb's point, which I'll actually try and get in here. And then over the pulmonic. And over the aortic. Great. And while I'm here, I'm just going to go ahead and listen to your carotids. Great, and I don't appreciate any bruise when I listen over your carotid arteries. In listening to your heart, I've heard S1 and S2 throughout. I didn't appreciate any murmurs. I didn't hear any additional heart sounds, S3 or S4. I'm going to actually have you sit up and just listen to you while you're sitting up as well, just to assess for any aortic murmurs. So I'll use my diaphragm. So I'm going to listen over the aortic, pulmonic, so then the left sternal border, just going to kind of reach under here. And then right over here, excuse my cold stethoscope in hands. Great. And again, I don't hear any additional sounds or murmurs. I didn't hear any splitting of S1, S2. So
Great.
you can go ahead and lay back down. Let me just take a peek here. So I am going to we'll skip percussion of your chest only because we already palpated your PMI, so that I kind of know where the location is and we're happy with that. Let's go ahead and, excuse me, 1 second. Yeah, so I think that's actually it for that. Sorry, I'm just kind of catching myself up on our new system here. We have a new system in
Always an update in software as soon as you get used to it.
What do you do for work?
I'm a nurse too, actually.
Oh, where do you work?
I'm at Boston Medical Center.
Okay.
Yeah.
What area of nursing are you
I'm in
in?
the pediatric emergency department.
Oh my goodness.
Yeah, busy time of year.
Yeah,
Yeah.
I bet. That's
Yeah.
a tough place.
Yeah.
Parents, kids,
Mm-hmm.
the emergency room, everybody's stressed. That's difficult.
Yeah.
I give you
everything
credit.
beeps.
Yeah, I'm sure you guys have plenty of keeps you busy there.
Yes. Yes.
All right, so let's move forward and go ahead and do your abdominal exam. So I'm
Okay.
actually going to lower the head of the bed here.
Okay.
Have you had any issues lately with your GI system? So any problems going to the bathroom, having normal bowel movements? Glorious. Peeing normally?
Yep, like a racehorse.
And when was your last menstrual period?
2 weeks ago.
2 weeks ago? Okay.
Yes.
All right. Great. And normal timing and everything for you?
Yes.
Perfect. Nausea, vomiting, diarrhea?
No, everything is good. I would say I have a negative review of systems.
That's fabulous.
Yes.
Great. All right, we're raising you up here. Okay. So I'm going to start by inspecting Molly. Her abdominal contour is flat. I don't see any obvious pulsating masses. I don't see any active peristalsis, but that wouldn't necessarily be an abnormal finding. Her skin appears without signs of trauma. I don't see any lesions. I see just like a normal distribution of freckles. And her umbilicus is inverted. Doesn't look like there's any bulges or swelling or any abnormalities there. So I would then move on and go ahead and listen to your belly. Okay. So I'm just going to take my stethoscope and listen over the 4 quadrants. Okay. Sorry if it's cold. Great. You have active bowel sounds throughout. I'm going to go ahead and listen to your vessels that kind of run through the abdominal cavity. So I'll start with the aorta. Listen to the renal arteries. And then the iliac arteries. Okay, I actually wanted to listen to your femoral arteries, which are a little bit lower here, so whatever you're comfortable with, I can go over your, you're comfortable if I just listen right there? Perfect. All right, while I'm here, I might as well, I'm just gonna actually palpate your femoral arteries. They're 2 plus equal, and I'm just palpating your inguinal nodes here. No pain or tenderness there.
No.
They're non-palpable. Great.
Okay.
So your arteries, your aorta, your renal arteries, and your iliac arteries, and your femoral arteries were all free of bruits. I didn't hear anything abnormal there. So let's go ahead and move on to percussion. So I'm just going to kind of tap on your belly with my fingers. Just let me know if you have any pain. Okay. I'm just listening for the sounds that I hear. Okay, so tympanic throughout. I'm going to go ahead and percuss to find out the span of the liver. Okay. So I'm going to start low and work my way up. Here, I'm just going to kind of mark this area. I'm going to start from up here and kind of work my way down. So, sorry if this is kind of, this is tricky, a tricky location. All right, so I'm gonna say, with my measuring tool here, that the liver span was, looks like about 6 to me. Okay. So we'll say that's a liver span of 6 centimeters, which is a normal finding.
Okay.
I'm gonna do the same thing with the spleen.
Okay.
And essentially what I'm looking for is the spleen usually lies above the costal margin. So I shouldn't feel it below your ribs. So I'm just gonna go ahead and percuss up. Still feels tympanic, sounds tympanic rather. Great, so I think we can safely say that there's no splenomegaly present. Great, so I'm gonna move on to palpation. So I'm just gonna start by lightly palpating your abdomen. Tell me if you have any pain or tenderness with that. And the patient's not guarding. She's denying pain and tenderness by shaking her head no. I don't feel anything obvious on that initial assessment, so I'm going to go ahead and do some deeper palpation.
Okay.
So just tell me if you're having pain there, okay? Just going to palpate in here. Any pain?
No.
Great. So a few tests that we could do if you were complaining of pain, depending on what we were looking to rule out, would be one of which would be rebound tenderness, which we would start by starting at McBurney's point, which is sort of in the right lower quadrant. I would push in with a deep palpation, and then you would tell me if you had pain when I released my hands, or on palpation. So we can simulate that.
No pain.
Any pain? Okay. So that's a negative finding. If she did have pain, it would be a positive finding. The other test that we use is called Rovsing's sign, which would be essentially the same sort of a test, but on the opposite side, on the left lower side. So again, I'd push in, and then I want you to tell me if you have pain here or here.
No.
Neither. And the pain that you would be feeling would be, when I'm pushing in or releasing, it would be on the right side. That's what we'd be looking for a positive sign for Rovsing's. Who knows?
It's a tough word.
It's a tough one. So then there's a few other tests that we would do to rule out appendicitis, which is in this right lower quadrant.
Okay.
The psoas sign, which I'm going to do by, I'll just show your leg here. So you can actually just straighten your leg out for me and keep it there. And I'm just going to ask you I'm going to hold down on your leg here and just push up against me. Lift your whole leg. Great. And if you had pain when you did that, or you weren't able to do that in this right lower quadrant, that would be indicative of inflammation of the appendix. And then the last one for that, I'm going to actually lift your leg up here and hold it up. The obturator sign would be if I hold your knee at a 90-degree angle and then internally rotate your hip. Any pain with that?
No pain.
No. Okay, great. So we'll just relax that down. Perfect. Few other exams we can do, one of which is Murphy's sign, which is if we were concerned about gallbladder inflammation. We would go ahead and deeply palpate we can use the hooking method, so sort of on the right costal margin border, like epigastric, sort of right in that area. And I would deeply palpate, and as I do that, I'm going to have you take in a big deep breath.
Okay.
So I'll tell you when. Breath. Any pain?
No.
Great. So if the patient had an enormous amount of pain or was not able to do that, that would be a positive Murphy sign for indicative of inflammation of the gallbladder. And then lastly, if you don't mind sitting up for me for a minute, I'm just going to have you sit forward, and we would be assessing for at the costovertebral angle, which would be right about here, on both sides for CVA tenderness. So if you can tell me any pain?
No.
Pain here?
No.
No. And that would be indicative of any kidney injury or inflammation.
Yeah.
And that's negative. Great. So lastly, I'm going to go ahead and palpate your liver and your spleen, and also your aorta, the large vessel that runs through there. So let's start with the aorta, just because it could be a little uncomfortable, and excuse my hands,
That's
my nails.
okay.
But so I'm going to deeply palpate right in the middle. I'm looking for an aorta that's less than 3 centimeters in width.
Okay.
That would be a normal finding. So I'm just going to go ahead and palpate down. You okay?
Yeah.
So I do feel like I can feel it. It's a deep organ, but and the width to me seemed like it was closer like 1.5 centimeters. So
Good.
we'll say that that's a normal finding. And then I'm going to go ahead and palpate the liver. So I'm going to start low and kind of palpate up for the liver's edge. So have you take a deep breath. Okay. And another deep breath. Okay, another deep breath. All right, so I actually did feel the liver's edge, and it's smooth as it moves underneath my fingers as you inspire, and it's being pushed down there. So it's a normal finding. And then I'm going to do the same thing with the spleen, which we shouldn't feel it if for a normal finding, but we're going to kind of make our way across there. So I'm going to palpate across.
Okay.
And can you take a deep breath? Deep breath. Deep breath. And I don't palpate it, so that's a normal finding.
Good.
And we already percussed, so we sort of have an idea of where it is in the chest wall there, abdominal cavity. Great. Give me 1 second. I'm just going to take a peek at my notes here.
Could you check me for ascites? I drank a lot on Sunday.
You read my mind.
Yeah.
I was just about to take a look there.
I drank a lot. I'm worried about my liver.
So tell me about this drinking. What do you mean you drank a lot?
Oh, I'm coping to get through school. No, I'm kidding.
Oh my goodness. Okay. Oh, you're in school too.
Yes, yes.
Okay. All right. So you were worried about, you drank a little heavily on Sunday?
I drank a bit on Sunday.
How often does that happen?
Not much since I'm in school. I pretty much just do homework and work. Yeah.
All right.
Yeah,
And you have, what other coping mechanisms would you use instead of drinking? Like typically,
I
what
started
do you
Pilates.
Great.
Yeah.
How's that going?
Do that 3 or 4 days a week.
That's a tough workout.
Yeah, I'm really not flexible at all, like physically or emotionally. So I'm trying to do some Pilates.
Well, we all have room to grow.
Yes.
So these are baby steps. You're working on the physical
Mm-hmm.
flexibility. Eventually, the emotional flexibility will follow.
Yep.
All right. Well, in all seriousness, I want you to, know that if you do need to talk more about any issues related to drinking or substance use or just healthy coping mechanisms, we all have our, kind of challenges and things that we need to deal with. So just know that you can, talk to me about it if you feel like there's anything else you want to chat about. And we can check labs too if you feel like that. Okay. All right. So let's go ahead and test for ascites, which we could do the wave test. So that would be essentially like if you did have a big belly full of fluid, which I don't appreciate now, we would want to verify what that fluid was and if it were kind of mobile. So we could come on this side. You can just lay flat. You're fine. And then I would just sort of pull on you and we could see the fluid move across. Which would be indicative of like that was fluid, that was kind of moving. The other exam that I actually prefer to do is, so again, percussing. So I would percuss the abdomen, and while you're laying flat, you should have dullness on the lateral sides of the abdomen, and then you would have tympany, or like that kind of hollow sound on the top because the air would rise to the top. Then I would have you roll onto your left side, and then I would go ahead and again percuss up here, where the fluid was, and I would hear tympany in this lateral side in addition to like kind of up here, and then down here would all be more dull because it would be fluid there. So either way, that's what we would do to assess for ascites, which I don't appreciate that you have an enormous amount of that. So, thanks. Great. Lastly, I forgot one other thing I wanted to do. As I was listening, I forgot to listen for any friction rubs over your liver and spleen, so I'm just going to do that real quick before I move on to peripheral vascular. Just kind of... And I don't hear any venous hums or friction rubs there.
Good.
Okay? Great. So lastly, we're just going to overall do a quick assessment. Are you comfortable laying down still?
I am, yes. Great. Yeah. Of
your peripheral vascular status. So I've already sort of looked at your skin. Is it okay if I expose your lower half here? Just looking, I'll start in your upper extremities, but your skin is appropriate color for your ethnicity, pink, warm, and dry. Your nail beds are pink. Your cap refill is 2 seconds on your right hand and 2 seconds on your left. skin color or skin temperature is equal bilaterally, and I don't notice any swelling. I'm going to palpate your radial pulses, 2+, regular rate and rhythm, which I appreciated when I was listening to, but also while I'm palpating. I'm going to go up to your brachial arteries. Tricky little guys.
Yeah.
Okay, 2+ and equal bilaterally. I'm going to just go ahead and palpate behind your, a little bit above your elbow up here for any epitrochlear nodes. Any pain there?
No pain.
No? I'll do the same thing over here. Any pain?
No pain.
No pain? Great. So yeah, I don't appreciate any edema or swelling, and no obvious skin abnormalities on your upper extremities. And then I'll move to the lowers. So I'll do the same thing. I'm just going to check your cap refill. Lovely nail color. And your toes are a little bit cold, but they're evenly cooler, which that's, you know, environmental, can be ambient temperature. Her legs are nice and warm. I'm going to feel her pedal pulse, dorsalis pedis, 2+, great perfusion. And then your posterior tibial pulses, again, 2+. Perfect. And then I would expose. Actually, I'd like to look at your entire leg, but in the interest of, you know, keeping you clothed for,
we'll just go knees down.
We can, but hair distribution is even throughout upper and lower extremities.
Yes.
And I don't notice any swelling. The legs look symmetrical to me down here. I do see a bruise over here on the left anterior shin. It looks like it's sort of older. Do you remember what?
It's a mystery.
It's a mystery bruise.
Mystery of unknown origin.
Mystery bruise. Do you get mystery bruises? Is this like a common occurrence or?
No.
Okay.
No.
Just a one-time thing.
A little surprised that I found.
You look like you're pretty active. You go to the gym. You look like physically
I try not
fit.
to run into things.
Well,
yes.
that's what we
not
all do.
Being assaulted, so.
Good. Okay. Good.
Yes,
You're feeling.
I feel safe.
Okay. All right. Great. Perfect. And I also noticed you have a scar over here on the right anterior knee. You had
3 knee surgeries.
3 knee surgeries.
Yes.
Okay. Wow.
But the last was 12 years ago. So
Okay.
we're all good.
Long time out.
Yeah.
Great. Okay. I'm gonna just cover you back up here, and a couple of special tests that we could do to assess the peripheral vascular system. One would be, well, I'll start up here actually while you're already laying down, but we could do an Allen's test. I'm just gonna move your hairband up. Oh, you already know it. That's because you're a PDED nurse.
Yeah, well,
That's it. You do arterial sticks, I'm sure, all the time.
Try not to, but yes.
So what I would do is have the patient make a fist. I'm going to occlude both the ulnar and radial arteries. And you hold a tight, tight fist. And I'm going to lower it down a little bit. And you can just relax. And I'm going to release the ulnar artery. Great. She pinks right up. Should be within 3 seconds, the same as cap refill. So we're going to do the same thing with the radial. So I'll have you make another fist for me when you're ready. I'm going to hold pressure. And you can release your hand, and I'm going to release the radial. Pinks right up. So great perfusion. I would do the same thing on the other side, but in the interest of time, we'll move on.
Okay.
And then lastly, we're going to do a little maneuver. I'm going to lift your legs up, and we're going to hold them up there for about a minute or so, maybe a little bit less.
Great.
Let all the blood kind of drain back, so your feet might get a little cold and white looking and a little tingly.
Okay.
And then I'm going to have you sit up over the side of the bed and just dangle your feet. So let me just lower the bed before we do that, so you don't have to jump 10 feet down.
Lower ab crunches.
Yeah.
Over there. Okay.
So how much longer do you have in school?
Well, they just moved it up, so I will be graduating next spring instead of in 2 years.
Were you supposed to be 2 years?
Yes, we're supposed to be 2 years, but now I'll be taking
good for you.
Quite the load in the spring and in the summer. But
all right, let's look these up. Wow, it's going to be busy, but you can relax on my arm. I'll hold you up here. That sounds like and you're working full-time or full-time?
Yeah. Well, ish. I'm going to try to cut back to, 32 hours. But
that's still pretty close to full-time.
School, you know.
Yeah, with school, and then you have to do clinical rotations, right?
I have a friend who is working full-time and a TA and a clinical instructor and in school.
She sounds like
she has no free time.
She sounds like a workaholic.
She really does. Yeah. But she gets it all done. She gets it done.
All right. Well, I think we've been about a minute, so I'm going to have you just swing your legs over the side of the bed there and drop them down. And then we'll take a peek and make sure that they pink right up,
Yep.
and they look great. So they should pink right up within 10 seconds. I
Yep.
think
I wore flip-flops a lot this summer.
I can see that. You have
Yeah.
some nice tan lines there. Do you have any questions for me? I think that's kind of all the information that I needed for today.
No, I'm gonna live.
Yeah, you're gonna make it.
Okay, good.
We'll see you back here in a few.
All right.
All right.
It was
So
nice to meet
it
you.
was great to meet you too. Take care of yourself in the meantime, and
Will
please
do.
call with any issues or concerns.
Thank you.
Okay. Nice to meet you.
Have a good day.
Okay.
Nice to meet you too.
Bye.
Bye.